Hello there. This is Dr. Patty. I hope you can hear me well. And I'm very excited today because I'm going to be able to show you a little bit about what we've learned over the past few years in terms of how we naturally and restoratively correct cholesterol elevation and sugar elevation. And I think that the base of this is very well put by Carl Sagan, where he says that science requires a strange mating of two contradictory tendencies, a willingness to consider even the most bizarre ideas, and at the same time, a harsh skepticism requiring hard evidence to back up every claim. And with that, we started to explore other options to correct cholesterol and diabetes. This webinar will be available on MD Prescriptive's website, and the instructions are there as follows. The first thing to note is that the idea that cholesterol is bad for us is something which has been sort of a myth, because cholesterol, it turns out, is an essential building block for our hormones. Imagine that estrogen, testosterone, DHEA, progesterone, and cortisol, all very important hormones, are directly made by the body from cholesterol. So are bile acids. So is vitamin D3, brain and nerve cells. Cholesterol is a major building block for cell walls and cell turnover. So obviously, it's an important component of our body. Normally, we start with the cholesterol LDL, which is considered to be the relatively bad cholesterol and the one that actually increases atherosclerosis. We start around the 60s to 70s. That would be an optimal LDL. If you look at the medical laboratories, they continue to call the LDL normal until it reaches somewhere between 100 and 130, of course, depending upon which lab is used. But what we know is that when you see your cholesterol creep from 70 to 85 in terms of LDL, you already know that something in the body has changed. Something in the way that the bowel and the liver and the gallbladder are processing this LDL cholesterol has changed, unless, of course, your dietary intake has changed. So even though a laboratory may consider the 85 to 90 normal, in a restorative approach, as soon as it starts creeping up, you have to ask yourself, have you developed a Lipitor deficiency? We know, of course, that Lipitor or all statin drugs are one of the top medications that are prescribed in the world today. But we also know as time goes on, for example, that statins cause muscle damage. And as a matter of fact, the muscle damage is now known to occur in all of the cardiac muscle of the body because there's a certain amount of breakdown that the statins cause in the process of lowering cholesterol. Let's look at blood sugar. Blood sugar goes up with age. It may creep from 70 to 85 to 90 and all the way to 126 where we define diabetes. But we know that even though 85 is defined as a fasting blood sugar of normal, the mortality rate for men with a fasting blood sugar above 85 is 40% higher than the other part of the general population. So we know that that means that anything above 85, and we're starting to put sugar onto the other molecules, the vascular system, the nervous system, the back of the eyes. What happens with this sugar is that it starts glycosylating or binding to organs and freezing them. So as it binds to the vascular lining, it creates stiffening and hardness of the vessels. Is the cholesterol elevation a Lipitor deficiency? Is the fasting blood sugar a metformin deficiency? Or is it possible that the absence and deficiency of hormones and the deficiency and imbalances in nutrition, and the addition of toxins and the inability to clear toxins by the liver and the gallbladder, the additional part of the state of our mind and the stressors in our life, and the state of our structural body, our ability to exercise and get the oxygen and lymphatic system moving. I would put to you that the answer lies in this. Obviously, many of us may think that genes cause it, and wouldn't that be very disempowering if you thought, well, you know what, I just have bad genes. But it turns out that when you look at disease, less than 10% of most diseases come from genes. Even cancers, they're now identifying that somewhere between 6 to 9% of cancers are from a genetic predisposition. So the rest of it is going to be from imbalances in these areas that affect how those genes are expressed. The corrective therapies for any of these things are going to be to start to rebalance the hormones, and I've mentioned some of them there, rebalance the nutrients so that everything can work, remove and correct and optimize the way that the bowel and the liver and the gallbladder work, stress reduction, exercise, get your body moving. So let's look a little bit more deep. Which hormones specifically affect cholesterol and sugar metabolism? One major hormone is progesterone in women. It has a very profound effect, and progesterone levels fall to almost zero by the age of 35 to 40. So that's when we start to see sugar creep up. The next one is going to be testosterone. Testosterone is critical in controlling sugar levels. In fact, many diabetic men will be completely reversed from diabetes and any of their statin drugs, which I'll show you an example of, as soon as that insulin resistance is corrected by giving the testosterone. The next one's going to be the thyroid. Thyroid, in the literature, and dozens of studies showing that low thyroid is associated with high cholesterol, total cholesterol, and high LDL levels. And as we start to correct these thyroids and these testosterones and the progesterone, not only does the cholesterol come into check, but so does the sugar metabolism. So obviously what I'm saying is measure your hormones. Nutrient deficiencies that affect cholesterol and sugar metabolism include omega-3 levels. Some people may know this as fish oil. Iron. All the B vitamins are involved in cholesterol support. So obviously if you're under a lot of stress and you're using B vitamins, your cholesterol could go up just from that. Chromium and vanadium, critical for the receptor that allows your sugar to be stored in the appropriate way inside your cells rather than floating around. Fiber. Magnesium, a critical part, again, of sugar control. Fiber, soluble and insoluble, correct cholesterol and sugar. The soluble fiber is more directly involved in binding sugar and reducing it, and the insoluble fiber in helping you to get rid of cholesterol that is not beneficial for the body. So what do we do with this? Measure your nutrients. There's a test called SpectraCell. This is done by blood, and it turns out that there's a lab in Houston that does this, and most insurance companies cover these kind of testings with some kind of a copay. But you can actually get a very good idea, if you look at the squares, of where you are in terms of your B complex vitamins, for example. Or the whole panel includes all of the nutrients. I'm giving an example here. You can also measure your antioxidants. This is a sample of somebody who was done with the 45th percentile for their antioxidants. And as time went on and they were treated, they brought their antioxidant function to 65th percentile, which means out of 100 molecules bombarding their body and trying to cause damage, 65 of them are able to be addressed through their own internal antioxidant function. You can also measure your omega-3 index, and that gives you an idea of whether you are eating enough omega-3 from your natural sources or whether or not you need to supplement with fish oil. It turns out that the concept that everybody needs a certain multivitamin or a certain omega-3 is not verifiable unless you measure. Your food intake may be taking care of your nutritional needs, and it may not be. So measurement is a critical part of putting some kind of objective measure on your nutritional status, because it'll tell you not only if you're eating adequately and if you need supplements, but it'll also tell you whether you're absorbing and whether you need more to keep up with your utilization. This HS omega test, which is also done by that same lab, shows that as the omega-3 content of the blood increases, the relative risk of cardiac arrest decreases sharply by 90%, as you see in this slide. The third component of this is to address toxins. First, of course, to reduce the toxins that we are exposed to on a daily basis. And this really involves what? It involves getting knowledgeable and educated about what the toxic loads are coming from and how they can be eliminated. What kind of skincare products are not petroleum-based? What kind of animal products are not treated with hormones? How to clean your home and office? How to get your food without preservatives and dyes? The other part of this is to improve toxic clearance by increasing the tissue pH with plants and oxygen, and correcting and optimizing the way in which the gallbladder, the liver, the bowel, yes, we have to have 3 bowel movements a day. Look at a pet, look at an infant, they eat, they poop. And lymphatics, kidney, and skin. So our body has a relatively complicated and complex methodology of removing toxins. Optimizing each of these organs is the way that we can optimize the toxic clearance. I'm going to share with you a program with the results from over 1,000 patients that we've had over the last 8 years, which has resulted in reduction of disease risk factors, a 20 to 40% reduction in total cholesterols and LDLs, a triglyceride drop of 50 to 100 plus points, and hemoglobin A1C drops of up to 2 full points. We know that hemoglobin A1C is a measure of how much sugar is on hemoglobin, and if that much sugar is on hemoglobin, we know that that much sugar is also on other parts of the body. We've also seen sustainable improvement in body composition as we start to correct metabolism by correcting some of these things. I'd like to give you an example. I'm going to go through 2 cases, and then after that, I'll be ready to take your questions. So the first case is a 57-year-old male who actually came in complaining of a low sex drive, rating it at 2 out of 10, 10 being the best, low motivation, 2 out of 10, depression, anxiety at 7 out of 10. He was on Zoloft. Weight gain of 22 pounds, energy of 4 out of 10, high cholesterol of 276, and he was on Lipitor. Do we really think that the low energy and the weight gain and the low motivation are underlying causes are any different from that causing high cholesterol? Absolutely not. In a male like this, we always order serum labs, and you can ask your physician to order such labs for you, so that you can see where you are on all levels. And you also want to order nutrient and get nutrient testing. So in this male, his testosterone level was 237, considered normal by the lab, but we're looking for an optimal level, which the range is 200s to 1100s, and we're looking for the upper quartile of above 800. The thyroid was low. The total cholesterol was 280. And the LDL was 130. These are all numbers which we want to see lower. Total cholesterol should be under 200. LDL should be under 70, as we noted before. Nutrient testing revealed low Bs in less than the 25th percentile, low omega-3, and low magnesium. So obviously, from what we discussed before, this in itself could correct the cholesterol. So let's see what happens. The corrective therapies, of course, in this man are going to involve testosterone and thyroid, a multi with high-dose Bs, omega-3, possibly plants and superfoods, toxins, definitely increasing the plants to at least above 50%, clearing of the toxins, stress reduction, and exercise. So let's look at what he did. We provided him with literature. We gave him a plan with all 5 points addressed on the plan, which obviously is an aha moment for most people, because to realize that you can actually correct the original things that were increasing the cholesterol, and, oh, by the way, you'll also have better sex drive, better energy, sleep better, less anxiety, and so on and so forth, is very empowering. He was started on testosterone and thyroid. He was started on B12 by injection initially and then came off of it. We usually use that for a short period of time. He was started on the multivitamin Essentials 5-in-1. He was started on 3 grams of omega-3 and some vitamin D. What we were looking for in supplements, A, was no preservatives like magnesium stearate, no dyes or fillers, biological forms without any zinc oxide, for example. The body can't use any mineral in its oxide form. So anytime you see oxide, you know the company has skimped on giving you a product that is a little bit less expensive and fits into less capsules. Spectrophotometric testing for all raw materials to make sure there's a lack of contamination. Glass bottles or bisphenol A-free plastic. Vacuum sealed instead of being heat sealed, and heat of course destroys the contents, and UPS shipping doesn't radiate as opposed to many of the other shipping mechanisms. So there are some criteria you're looking from. The basic supplementation for every patient, and even if you look at the Journal of American Medical Association, they published in 2002 their conclusion that every person should be on a multivitamin mineral and an omega-3 fish oil in order to prevent chronic degenerative disease. This, of course, followed the fact that our food supply has gone down in nutrition by so many fold. The multivitamin I use is basically chosen because when I hold it up against the other things, it has more activated Bs, it has more of the Cs, all of the volumes of the different things are just at the level that we want to specifically activate the hormones and help us lower cholesterol and sugar. For example, you'll see on this page the chromium is 500 micrograms, which is the therapeutic dose for helping the insulin receptor in a diabetic. 400 micrograms of selenium, for example, on that first row. And various other things. If you compare, for example, to Centrum and GNC, there's certain doses that you want. But remember, what I'm saying is that you, even with these doses, you always want to measure. You don't want to be over and you don't want to be under. You want to be optimal. So the best way to know whether your program is hitting what you need is to actually measure. The omega-3 can be used not only for cholesterol, but as you may know, omega-3 is a primary treatment for anxiety, depression, PMS, ADD, and inflammation. According to the U.S. Department of Health Services, omega-3 fatty acids is one of the primary and secondary methods of preventing cardiac and coronary events. The amount of literature on this is unbelievable. There's over 8,000 randomized controlled trials showing that fish oil can decrease stroke mortality and also fish consumption. Here, in 5 weeks, the relative risk was less by 36%. So it's huge, and this was published in 2004. Also, as you'll note in this slide, published in 1997, that the baseline triglycerides go down precipitously when you put 4 grams of what they call DHA-EPA, which stands for dexahexaenoic acid and eicosapentaenoic acid, on board. So this is a powerful mechanism of lowering triglycerides. The American Heart Association last year said that prevention or treatment should include 2 to 4 grams of marine-based omega-3. Some people do try to get this from vegetables. You do have to eat very large volumes of flax and hemp in order to get long-chain fatty acids in the range of 2 to 4 grams. You must increase your intake of fibers as well as reducing fructose, trans fats, and saturated fats. And with this approach, patients can expect to lower triglyceride levels by 20 to 50%. And I'm going to show you what we did in this gentleman, and you'll understand. The question of krill oil versus fish oil gets asked to me all the time, and it just turns out that krill oil is not stable and only contains at maximum of 24% omega-3. I like to use enteric-coated RX Omega. Obviously, it fulfills all the other criteria of spectrophotometric and glass bottom, but the main thing is that it's enteric-coated, which means that it's going to be doubly absorbed, so with 2 pills you get the full dose. In week 12, this gentleman on testosterone, thyroid, B12, essentials 5-in-1, and omega, very basic program of restoration. His sex drive has improved to an 8-9, his motivation to an 8-9, his depression and anxiety are at a 1, he's discontinued Zoloft, he still has some of the weight on him, his energy level is an 8-9. His labs, testosterone and thyroid are better, but look what happened to his cholesterol. Just by correcting his thyroid and his testosterone, his total cholesterol fell from 280 to 212. His LDL cholesterol fell from 130 to 115. And at this point, we would start working on the toxic aspect through the metabolic balance program, which I will share with you through this next case. I want to tell you that if we end up with somebody who cannot lower their cholesterol through, say, detoxification and so on, because maybe that's not what they want to do, the main point is you have lots of options. Cholestex is a natural lipid support. It includes many ingredients. It's extremely effective, and we use it in approximately 10% of our patients who are specifically statin intolerant and who do not want statins. But I can tell you that 90+% of people are able to lower it just by correcting the hormones and the nutrients, and then by going through the detoxification program, which I'm about to share with you next. And this is the next case. So this is a diabetic woman, 52-year-old woman with diabetes, and she's on metformin at 750 milligrams twice a day. She reports an energy of only 5 out of 10. She wakes up 3 times at night. She's depressed, not a 10, but a 5. Her sex drive is a 3 out of 10. Her serum progesterone is very low. Her thyroid is low. Her hemoglobin A1C, which is the measure of the sugar being put onto the other cells, is 7.2, and we're looking for a number under 5.3. Her fasting blood sugar is 111. We're looking for a number under 85. Her triglycerides are single-handedly the only single component that drives cardiac risk in the cholesterol profile. It's 288. It should be under 100. So you can see in this woman, even being treated for diabetes, she's not in an optimal state at all. And you can be sure that the same underlying factors that are contributing to her diabetes are the same exact underlying factors contributing to low energy and depression and the other things she's feeling. So this patient is again restored in the same fashion with some thyroid, with some progesterone, with some essentials 5-in-1, some omega, and some B12. Why? We're trying to get her to feel better. How do you put somebody through a detoxification before you feel better? Any of you considering detoxifying should first make sure that you're able to get your energy and your nutrition up, your sleep right, you're feeling right, and that's when it's time to start working on bowel and liver. By week 4, she does feel better. Her energy is a 6. She's not waking up. Her depression is a little lower. Her sex drive is still low. And there we have her numbers. Her fasting insulin should be under 2 is 18. Fasting blood sugar, which should be under 85, is 111. Triglycerides are 288. So at this point, we know that she is swinging high and low on this red curve. And we also know that she's, instead of, her sugars are swinging way up high and way down low. Way up high and way down low. Way up high, she's putting on and converting muscle to fat. Way down low, she's crashing. The blue line is where she wants to be. This program I'm giving you the first 6 weeks starts with a bowel cleanse in week 1 and goes to a liver cleanse in week for. It's a very simple program you can do at home. It starts with a 7-day vegetable cleanse, the purpose being to alkalinize the body and reduce the digestive load. I actually ask people to do this seasonally just to maintain their systems, but we know that this program will lower cholesterol and insulin resistance, and oh, by the way, it also reduces weight, usually between 5 to 10 pounds within the first 3 to 6 weeks. In this program, you avoid all meat, fish, dairy, eggs as they are acid forming and increase the digestive burden and byproducts. You avoid sugar, alcohol, soda, tea, and coffee. You minimize canned, boxed, processed, refined, overcooked, and microwaved. You also use a host of cleansing vegetables, and the main point here is get to the vegetable market, pick vegetables of different colors, pick out things you haven't eaten before, and start to experiment. My exposure to the number of vegetables I knew and had eaten was so much lower until I started picking up things that I didn't know what they were. And the nature has given us a bounty of vegetables with all kinds of different effects. So start exploring. The suggestions we usually make are that people start the week. You can eat all you want, but that they start the week with a cooking session and making a garden vegetable soup with all the vegetables, garlic, onion, ginger, grinding it up and cooking it, grinding it up, and having a soup that you keep with you, a cauliflower leek soup, roasted vegetable tray, and then that way you have something that you can always eat, because preparation when you're doing a vegetable cleanse is important, because when you get hungry you don't want to be starting to look for things to eat. So being prepared is critical. So making several recipes in advance and rotating, making a 7-day meal plan, carrying a large purse or bag with water and Tupperware, and most importantly, instead of focusing on what you didn't do, congratulate yourself for every success. And that goes for any of these programs. If I lay out 10 things for you to do, and your doctor lays out 10 things for you to do, or you have 10 things you want to do, and you do 2 of them, you should be congratulating yourself and putting your energy into those 2 things that you did. I do suggest a 7-day meal plan where you're prepared for breakfast and snack, and lunch and snack, and dinner and snack, and you can rotate it so that you can keep some variety. Definitely drinking water volume of half the weight. The family should participate. It's a great exercise for the family to do. Put yourself first. You're trying to get your health on track. Breathe. Relax. Don't be hard on yourself. Get outdoors. At least for 5 minutes twice a day. I suggest even more. If you can possibly take your shoes off and stand in the earth, you'll be grounding yourself to the earth, which increases the oxygenation of your red blood cells by manyfold. And then we use a few products to get the bowels moving. We use bowel cleansing product, a Pure Cleanse Bowel 1, which is herbs, and Pure Cleanse Bowel 2, which is fiber, and an upper and lower probiotic called Pure Biotic. You take 3 of these, 1 of each at every meal, breakfast, lunch, and dinner, because we're trying to literally stimulate and retrain the body that when I eat, you contract. When I eat, you contract. These are the products that we're using. And the most important thing, always celebrate your successes. And what you're in the process of doing here is taking the insulin highs and the insulin lows out. So you've done a week of veggie detox, and now it's week 2. In week 2, you're starting to move the red line closer to the blue line by adding the following concept. Breakfast, lunch, dinner, and snack should always be fashioned with 50% vegetables, 25% protein, 25% complex carbohydrates. This is actually a meal plan which should follow you for life. Whether you follow an animal-based protein or you use a plant-based protein, this exact plate ratio is what controls cholesterol and sugar the best. We ask people to take a total of 30 to 40 grams of fiber a day in both insoluble fiber and soluble fiber form. Insoluble fiber comes from things like whole wheat flour, wheat bran, nuts, and many vegetables. Soluble fiber comes from things like oats, peas, beans, apples, citrus fruits, carrots, barley, and psyllium. For those who are unable to get enough fiber, and we recommend 25 grams of soluble fiber, again, coming from fruits and vegetables and oatmeal and beans. For those who cannot get it from the food, you could add something like this product called Fiber Pro, which comes from a company called Karuna, and 60% soluble fiber, 40% insoluble fiber. So it's tremendous at helping to lower both sugar, which is bound by the soluble fiber, and also bind the cholesterol, which is bound by the insoluble fiber. You can ask yourself a weekly questionnaire where you're trying to just gauge your progress. And out of a total of 25 points, you try to gauge yourself on your water intake. If you're taking in more than 60 ounces of water, you get 3 points. Your average number of meals and snacks, if it's above 5, you get 3 points. The number of different vegetables you ate this week, if it's greater than 10, you get 3 points. These are your aims. Conscious breathing, bowel movements, you're aiming for over 3. New recipes tried. It's basically a way of following your progress and being happy and being able to have something to strive for the week after, and how many days of exercise you did. In week 4, we add to this regimen. By week 4, of course, the bowel cleanse is over. So now you start the liver cleanse. You always do the bowel before the liver because the liver will dump into the bowel. And although this is named Pure Cleanse Liver, this is actually aimed at liver and gallbladder. And if you look at the different products on the market, this is the one we picked because this is the one that has sort of all the ingredients. You can see it on the right column called Pure Cleanse Liver. We also can add Glucoax, which is a herbal formula to help control blood sugar, which we use not in all patients, but in some. And again, the mix that we're looking for is contained in Glucoax, and you can see that in the right-hand column compared to some of the other things that are out there. By week 12, in this woman, a fasting insulin was 18, and even though it hasn't come down to 2, she's at 11. Her fasting blood sugar came to 94. Her hemoglobin A1C came to 62 and 6.2. And that fasting blood sugar was 111 before. We're aiming for 85. The hemoglobin A1C is at 6.2. We're aiming for 5.3. Her triglycerides came down from 288 to 154. So a huge change. We still have work to do, but what she's done so far is she's corrected some of her hormones and nutrients, so obviously she feels better. She's also gone ahead and done a detox with a 1-week vegetable cleanse and bowel and liver. And at this point, we would continue along the same line, and by the way, that patient also lost quite a bit of weight along the process, and work on the exercise program, which is going to be, and the mind program, which is going to be the other 2 parts of the program. If I wanted to give you a summary of how it is that we would then approach either cholesterol or diabetes, it would be by optimizing the hormones, and the main ones we talked about were testosterone and thyroid, and progesterone, optimizing the nutrition, first obviously by measuring, and then by following a food program that is at least 50% vegetables in every single plate. Even if you eat a snack, like I can give you an example of a breakfast. A breakfast could be an egg for the 25% protein, steel-cut oats at about a cup, and the vegetables can be either a vegetable smoothie or roasted vegetables or sauteed vegetables, which you've kept pre-prepared so that you can fill your plate properly. So the hardest part is adding the vegetables, and that is the most important part in terms of soluble and insoluble fiber sources and reducing cholesterol and sugar values. We obviously used some supplements for the bowel and the probiotic and the Glucoax. And we also basically after the program suggest that you stay on some kind of multivitamin and some kind of omega. And I would like to very much thank MD Prescriptives for sponsoring this webinar. And at this point, I am ready for any questions that might be coming our way. So let's see here. I need some technical prowess here to get the questions. Okay. Is there a link between diabetes and body pH? Thank you for that question. So body pH is basically as the body pH drops, and we know that, for example, you can measure your body pH through the urine, and you're looking for a urine pH in the morning of above 6.7. And in that alkaline environment, the sugar and cholesterol are controlled the best. So obviously, as we raise our body pH, we're controlling all disease better. The best way to raise the body pH is by drinking more water, breathing more oxygen, and, you guessed it, eating more plants. Then the next question is, how can I schedule an appointment with you? And that is something which you can call the phone number at Sejun. In your opinion, what is the most important out of the 5 areas, hormones and nutrition? And there is no most important area. I really could tell you that if there was a most important area, it certainly would be the mind. We've started to learn that, the mind immediately converts thoughts into neuropeptides. And so we have more control over what happens in our body just by what we think than actually taking a pill or doing surgery. What source of protein would you recommend for vegans? So there's a varied source of protein is what we recommend. So obviously it turns out that plants actually have, if you're eating enough volume, just as much protein as animals, and in fact much more utilizable protein. If you take 500 calories of animal protein and 500 calories of plant protein, it turns out that each one will have approximately 34 to 33 grams of protein content for that 500 calories. In fact, there's a whole Guinness Book of World Record holders who are bodybuilders who actually are completely vegan and are sustaining their muscle mass on a vegan diet. Some of the other sources that we recommend are brown rice, hemp, and other things like that. How do you incorporate healthy fats into your diet, and how much do we need? So this is an excellent question. Healthy fats can come from nuts and seeds and avocado and olive oil. And how much you need, these should not be eaten in great content, but it's clear that if you take the plate and put about 5% of it in that fat category, you'll be in a very good place. And let me see. I think that's all the questions that we have today, and I really appreciate you paying attention and signing in today into our webinar. So if you have any questions, you can direct them to the MD Prescriptives website, and you can also direct them to your physicians. This is a good program for you to talk to your physician about, and to ask your physician whether or not and what parts of this program are applicable to you. Then the next question, we got one more question. We read a great deal about the value of alcohol, 1 per day. What do you think? The studies on alcohol that were initially done showing that alcohol reduced cardiac disease were originally documented in France. And obviously, one of the things I would put to you is that anything in moderation is something which moderation is always our basic premise. But when we dissected the French study a little bit more deeply, it turned out that the French also had other factors like walking more, eating more fresh vegetables, sitting around and enjoying their meals for longer, with a different lifestyle, completely a different lifestyle. So obviously having that different lifestyle, it turns out, was probably responsible for a great deal of that effect. And we've now found that resveratrol alone can actually make some of that effect, and obviously some of the stress reduction qualities of alcohol can give you that effect. But one of the pieces we didn't pay attention to was that in that very study in France, they also had the highest rate of liver cancer in the world. So there is a trade-off. I think that, again, in moderation, this is what we're trying to do. We're not trying to take away everything, because obviously there's something called the pleasure principle. What we're trying to do is make life better, not more compromised and restricted. So thank you for that question. The next question is, what are some of the anti-inflammatory vegetables or fruits? The anti-inflammatory vegetables or fruits, basically all fruits and vegetables are going to be anti-inflammatory. You're trying to get as many different colors in per day. For example, you're trying to get 8 different colors of vegetables or fruits in per day, because each vegetable and fruit that's a different color is going to be a different phytonutrient. And we also know that because the nutrient and antioxidant content of our regular vegetables have fallen, there's a study that was just recently done and published, the Worthington study, which shows that the antioxidant value of organic vegetables is about 30 to 40% higher than the regular. So the general premises would be, try to eat organic or locally grown. Try to eat vegetables that are picked rather soon to your eating. For example, of organic apple that has been stored in a Seattle warehouse for a full year before you've had access to it is not a very beneficial antioxidant-wise, because that content goes down over time. So local markets, organic, variety of colors, and then there's those foods that are going to be super dense, things like aloe and coconut and hemp and what we call the superfoods. And there's many books these days on superfoods and many recipes on superfoods, and the more raw you eat them, the better, because obviously the minute that you cook it above 118 degrees, you start to denature some of the phytonutrients and some of the anti-inflammatory and antioxidant potential. And that is going to make our last question. I appreciate your great attendance during this thing, and we hope to see you at a future webinar.